Welcome to the Eyecare Experts. I'm Dr. Bell, Dr. Terrezza, and we've got Dr. Martin with us again on this podcast. So thank you for joining us. Welcome back.
Yeah, happy to be here.
Yep, we're glad to have you. Before we get going on today's topic and everything, tell us a little bit, where are you practicing mostly at office-wise, or are you between two locations so patients can find you?
Yeah, so right now I'm mostly at our Fairfield office and our office in Milton, so you can see me at either of those places.
Gotcha. And seeing a lot of medical, vision, anything you need. I think that's I would say the beauty or one of the good things about us is at each location we have equipment, testing, visual fields, OCTs, everything we need to kind of do medical testing at each office, which makes it really nice.
Plenty of diversity.
Yep.
All ages too.
For sure. Yep, we'd see no limitations on kids or anyone of any age. But getting to today's topic, and actually this will kind of feed into it, we're talking about systemic health conditions and how those health conditions impact or correlate with the eyes, which there's a lot of systemic things out there. And certainly from our standpoint, the one good thing I note nowadays is primary care specialists are referring patients to us to get at least the annual eye exam, the dilation where we can look in the back of the eyes, because I think they and everybody is starting to realize the benefit of us looking in the eyes, that we can tell a lot about a patient, whether it be blood sugar issues, blood pressure issues, cholesterol issues. There's a lot of things we can tell by looking in the back of someone's eyes.
I think that's the key thing I'd like the audience to remember, is that by doing a thorough exam with plenty of equipment, you can detect things that have systemic implications. And that's really part of an eye exam, and that's what you should expect. And we deliver that.
Yeah, and I think sometimes it's you already know you have something like diabetes, and so you get your annual eye exam to make sure it's not affecting your eyes, but sometimes it's the other way around where you don't realize you have something, and then we find something on the eye exam and we can help get the process started.
And we've said this, if we said this one time, we've said it 100. With a lot of these things, certainly the earlier we catch it, if you have, let's say, diabetic retinopathy or something like that, usually the better the outcome is. We don't want to wait till you get fluid building up under the eye or you get a retinal tear or detachment. We want to catch things early and certainly be proactive and maybe even prevent it from ever even happening in the first place. So we definitely want to get you in. So at the very least, with any patient who has any systemic, and it could be pituitary issues, it could be thyroid issues, it could be autoimmune diseases. I mean, whether it's rheumatoid arthritis, Sjogren's, there's a lot of autoimmune things out there. We at least want to see you, once a year for that full, complete eye exam, dilation, checking everything. And then if we see any signs, whether it's maybe some blood sugar issues or diabetic changes, and then we bring you back accordingly. There's some patients I'll see every month, there's some I see every 6 months, just based on the severity of kind of how those systemic conditions are affecting the eyes. What do you usually do as far as just kind of I guess it depends on the severity, but you kind of have a protocol, and as far as, let's say, a diabetic patient, what do you typically do?
I do. For instance, I had a diabetic patient today. I had seen her 6 months ago, and she had some small hemorrhages in the back of her eye in the far periphery. And I ran an ERG today, an electroretinogram, which is now considered the standard of care for diabetics. And her function on that test was very low, lower than I expected. And when I looked closely, she had some micro aneurysms in the center of her eye. And so based on this thing and her poor score on the ERG, I then referred her out for further treatment to retina.
Yeah, I mean, what do you think? As far as diabetic patients, kind of watching, when, I guess for you, kind of when do you get to that point, or how severe does it have to be where you usually kind of send them to a retinal specialist? What would you say?
Yeah, like you said, if people just have diabetes, definitely yearly eye exam, and if the retina looks clear, probably keep checking them once a year. But kind of similar to what Dr. T was saying, if I see a little bit of retinopathy, I'll do 6 months. If I see more than a little, but it's not causing any effect on their vision yet, maybe I'll do 3 months. But if they start to have like that fluid buildup, or you can have growth of new blood vessels in your retina that can cause a lot of problems, if I see things like that, then I'll send them to the retina specialist.
And the good thing, I mean, nowadays is, I mean, certainly certainly we look, we're always looking behind a slit lamp or with a BIO, but we have OCTs, which can scan beneath the surface, can pick up the smallest fluid buildup, any edema, any blood. We have OCTAs, look at angio, looking at the blood flow in the back of the eye, which is amazing to me because that was not available when I first graduated school. And now we've even got ERGs. So we've got a lot of tools that are available to us, even a B-scan, to kind of monitor these patients and make sure they're, we're seeing and making sure there's not progressing, it's not getting worse over time, and then we can kind of figure out for all of us when, we feel like we need to get them to that surgeon or that specialist if they ever progress to that point.
One of the things that I think is cool that I'll, even bring up with patients sometimes is the eye is one of the only places where we can look in and see your blood vessels without having to do surgery or MRIs or things like that. We can literally look in and see what the health of your blood vessels look like. And I'll also tell people if the blood vessels in your retina are strained from like high blood pressure or diabetes, that means it's happening to the blood vessels in other parts of your body too. So it kind of gives us a little extra indication that we need to look closer at this stuff.
And so that old saying that we heard growing up, eyes are the window to the overall health is very true. We can see a lot. And these are patients that we sometimes get referred to us, but we've all seen patients that didn't know they had blood pressure issues or blood sugar issues, and we were the first one to see them and say, hey, this is what I'm seeing in your eye, and we even show them as far as a retinal photography, and then sure enough, they go get a physical, they go get that full exam, and then they find out, hey, my blood pressure is really high, or hey, my blood sugar is out of whack, or cholesterol. So, so on both sides of that, certainly we get referred in from PCPs, primary cares and specialists, but also, getting that annual exam, you may not even know you have any issues. You may say, hey, I thought I was fine. But we look in the back and say, hey, this looks to be maybe malignant hypertension, or maybe this has to do with blood sugar or cholesterol issues. Regardless of either one of those coins, we want to see you and make sure the health of the eyes is good along with your vision.
It's critical to differentiate that, and I think that people should be aware of that and expect that in their general exam.
Well, I think the newest, we're getting a lot of things, a lot of great commercials on television, and the one I see, I guess, the most lately is with thyroid eye disease, talking about Terrezza, and the correlation between thyroid and eye health. I mean, certainly there's cases where there's a lot of proptosis, there's eye pressure, there's eye pain, maybe you even get double vision. So these are things we monitor as well. So, any of these conditions, basically the point is we want to see you. We can see you for a full exam, but let's say, hey, you've got a red eye, your eye's hurting, this is painful, or maybe on eye movement, some weird stuff is happening, maybe double vision, or, hey, I can't even turn to my right or my left with my one eye or so, give us a call. We'll work in. We've got spots in the schedule for office visits. Depending on the severity, sometimes we can get you in the same day or the next couple of days, but we want to see you and figure it out and make sure we get you taken care of.
Absolutely.
One I can think of, and this is a little bit of a different direction than the ones we've already talked about, but one that I feel like I've found before they knew it was going on is IIH, or idiopathic intracranial hypertension, where people come in maybe because they've noticed a change in their vision, but they usually also have a lot of headaches. And when we look in the eyes and look at the optic nerve, sometimes it gives us signs that there's something going on behind the eyes in the brain. And that's one that I feel like oftentimes, as eye doctors, we're the first ones to notice something's going on there.
Sure.
And then once we send them to get more testing, they'll get the diagnosis and the treatment to help them feel better.
Well, all of these things feed into, we get the questions from patients and even some family members, why do I need to dilate? Why am I filling out all this paperwork? Why do you need to know about all these systemic conditions? Why does it matter what medications I'm on? Well, all this kind of interrelates because we want to know, certainly we want to get you seen the best, whether it's glasses or contacts, but the health of your body relates to the health of the eye, and in turn relates to your vision and correction and seeing well. And so I know it's a pain sometimes. I know some patients don't want to be dilated, but that certainly gives us the best view inside the eye to check the macula, the retina, the vessels, to make sure everything is healthy. And the one thing that Terrezza and I strongly believe in when we started years ago is is making sure certainly we get you to see well, but also the eye's healthy, and we want to kind of see you and monitor and establish a relationship with you where over time we're always looking at these things and making sure that it maintains that way.
And I think one of the best ways to do it is with the newer technology that's available today, which we have at all the offices. And so you can't possibly remember something that you saw in an eye or a blood vessel from a year ago. But with a wide field scan, you can catch that, document it, date it, and then look at it in comparison. And that gives you an idea of where this patient is headed, up or down. And that helps me a lot in diagnosing and or referring and making a decision on that when there's a lot of gray areas with that.
And even with diabetic patients, besides the health of the back of the eye, it can alter your prescription. I mean, we've all kind of seen patients who are maybe just getting started with medications, or maybe they're trying to figure things out, or their blood sugar is shifting very high and very low day to day. And then, we get them a pair of glasses, and a month goes by and they can't see with those glasses. And that's because maybe the blood sugar shifted a great deal, and the prescription is completely changed in those glasses. So, we want to look at all that. If you can't see through, something's going on. Typically, if your blood sugar is high, you go a little bit more nearsighted. If it's better, you go a little bit more farsighted. But we definitely want to, watch that as well. If for some reason you can't see as well, let's take a look at that. It could be your glasses, but it could be other things that are causing you not to see. And without us looking at everything, that's the only way we can sometimes figure that out.
Another example you kind of said earlier is with autoimmune conditions, which can have a lot of different effects on the eyes, but sometimes it will cause you to have inflammation inside your eyes, which can cause a lot of pain and light sensitivity. And similar to what we were saying earlier, sometimes you have this autoimmune condition and we can treat the inflammation in the eye, but sometimes you might not know it yet. And if you have a couple episodes of this uveitis or inflammation in your eyes, you can get testing done and figure out what the underlying cause of it.
And some of these can lead, we in some of our prior podcasts, we've talked about women's hormones, we've talked about glaucoma, we've talked about macular degeneration, we talked about maybe blood flow issues to the eye, oxygen. And, I get the question a lot, or, hey, if my blood sugar's off or my diabetic, how does that? Well, if they're not directly correlated, there's certainly some indirect relationships. And we want to kind of make sure one doesn't feed into the other and lead, because certainly with diabetics, you're greater chance usually to develop cataracts over time. Blood pressure issues may affect the nerve a little bit more. So it does put you at a higher risk for some of the things that we watch and monitor and talk about with the eyes. I know for me, the one thing that amazed me when I first graduated school was, aneurysms and tumors, and how you could do a visual field and how you could pinpoint exactly in the pathway where the lesion is. I still am amazed how sometimes we can do a visual field and say, hey, this is right here in the nerve tract, this is at the pituitary, just based on the visual field that we get. And a lot of times that's first line, where I've said we've all seen patients where, hey, maybe it's a pie in the sky, maybe it's a bitemporal visual field defect, and that helps us to know kind of, is it the pituitary gland, is it something else that's leading to these peripheral or side vision loss. And we want to catch that early and hopefully preserve some of that or get back some of that visual field loss.
With older patients too, the ones that have had a stroke, many times they won't realize they've lost their side vision, which is one of the first things to go after a stroke. So if you never measure it, you're never going to find it. And so we do that.
That one's kind of hard to pinpoint, I feel like, because I've had a couple people come in and say, there's just something going on with my vision, and they can't describe it, and then they're missing half their vision on a visual field. And it's hard for them to explain that that's what they're experiencing, because it's a weird phenomenon. But then, like you said, with the technology we have, we can narrow it down and figure out where in the brain it might be coming from.
And certainly, we want to know, but also the patient, make aware kind of what, hey, is it to the left you can't see? Is it to the right? And I always say, hey, we want to know today, but we also want to know over time, is it getting worse? So it gives us a baseline so we can watch it in the years to come to make sure it's not progressing or anything like that. But there's so many things we can tell. The bottom line is, all these systemic conditions lead to eye related, or, can affect the eyes, and we want to do all we can to make sure everything is good. But, I wanted to kind of go through, we've done 30-something, I think, podcast, and we appreciate you guys watching and listening. We just redid our website, I think, a few months back. And hopefully I think it's a lot more user-friendly, a little bit nicer with pictures and videos. But if you guys miss a podcast, or if you want to view one, you can go to the resources tab. I believe that's at the top of the screen. And if you click down, it'll one of the options will be media. And then it'll have a list of kind of all the podcasts that we've done where, hey, maybe you want to see something on myopia or glaucoma or whatever the topic is. We've done quite a bit that you can kind of see some of the topics and go back and look at it. So we're trying to incorporate that with our website. That way it makes it easier for you guys to view us and look at things. And, this is meant to be educational. We enjoy doing it, but it's certainly for the patients and for the people that are watching.
And also there, you can look at our 13 optometrists who are listed on there with the particular areas that they like. And you can scroll through those and see if any of those appeal to you, or you're more interested in one than another, and find out where those optometrists are and what their schedules are.
Yep, all the office locations, the numbers, addresses, kind of figuring out, because sometimes patients will call and say, hey, I want to get an exam, but I don't know which office is closest to me. But we're all on the same network. We all have the same computer system. And so we can, maybe we're seeing this last year at this office. Certainly it's easier for us to pull you up. We're all in the same system. And, I have patients who maybe go for an exam here, but may go somewhere else for glasses because that particular office may have a certain brand. It makes it very easy for patients to do that.
But they also have a wider selection with the 8 offices for
Yep.
just about any type they would like.
For sure. Yep. We try to have as much brands and options as we can. But we thank you for listening. We appreciate it. Thank Dr. Martin for joining us.
Yeah.
And until next time, thank you.
Thank you.
Appreciate it.